Hello again, everyone. Mark Hackle, Macomb County Executive, and Deputy John Paul Rea here in Macomb County. Just got to give you an update what's going on. Today is Tuesday. It's shortly after the phone lines had opened up, as well as the website for people to go ahead and try to get on board for a vaccine, an appointment. And as challenging it is, we went through that in a very swift process here. In fact, the online version, within 11 minutes, all of those appointments were taken up. The phone process, where they're talking to somebody on the phone, was considerably longer. But the reality is, we know there are people out there that are, I guess, if you will, a little bit unhappy, as we always see every Tuesday, because the phone lines get jammed, or even the online version. So it is, unfortunate situation we're dealing with, but that's kind of what we've had to deal with because of the fact that we've opened up for so many people and have been given so limited amount of doses to try to figure out how do we work through this.
Mark, all vaccines in possession of Macomb County are accounted for. This has been a similar process that we went through over the past few weeks as we've continued to scale up and enhance our systems to serve the demand of the public. Again, you go back to the foundational principle, there are limited doses in play, and any doses that Macomb County gets, we put through the most effective process to connect them to residents around the community.
Yeah, so we understand there's a bit of grousing that comes along with this, but the reality is, and it's kind of a term to put it lightly, I guess a lot of people are pretty anxious about it. So not trying to make excuses or try to point fingers, but let's get to the facts, okay? There's no question about it. Even the state has admitted there's just not enough vaccines, and for some reason, nobody can pin down what's going on with that. We have asked, the media has asked, everybody's asked, how is this vaccine thing working? Whether it's the Moderna, whether it's the Pfizer, the new stuff coming, where is it? And nobody seems to have that answer. And so with that being said, we know through admissions of the state and even the federal government right now, politics aside, there are a limited amount of doses available statewide and obviously nationally. So here in Macomb County, we've said it, we'll say it again. There's no question about it. We're getting 5,000. We ask for 50,000 because we know we can manage 50,000 here in the county. We don't know what the state's got planned, whether they're going to start opening up some of these other, if you will, pharmacies or doctor's offices. There is a system in place that we're normally accustomed to. Again, this is not something new to health departments around the state, that they do have a plan in place where you are going to be able to get those vaccines, but we're hearing absolutely nothing. In fact, just last week we were told not to submit requests for 50,000 doses anymore. We're just going to get allotment from the state. But that being said, we've asked, how are these allotments being determined? Is it based on population or some other, I guess, if you will, way of saying, here's how many you're going to get? No one has got the answer. And again, I offered that up to our state senators, our state representatives to get that. They too are challenged by not getting the answer. The media is not getting the answer. So this is where we're stuck. You got health departments that are geared up, they're ready to go, they've got all the space available, they've got the people in place to go ahead and administer it, but we're only getting 5,000 doses a day, but yet there's been an incredible amount of people that have been allowed into the system to go ahead and, if you will, apply for the actual vaccination. And that's been the incredible challenge. The demand does not have the availability of the supply right now, and people are frustrated with that.
Mark, as you highlighted earlier this week, 250,000 individuals eligible alone in Macomb County. We got 5,800 vaccines this week. That's not going to meet the demand. It's going to be nowhere close and everything. And then, as you said, how the state's going to build up the infrastructure to get it to other legitimate providers to be able to serve the public. So there's additional entry points that have everything that they need, from doses to administration to follow-up appointments. All that not only needs to be part of this rollout, but again, needs to be part of that key messaging that continues to be delivered to the public in the most efficient way.
And the part of that is not just opening them up, but make sure we have the vaccines to support that. So in other words, they can open up all the pharmacies and all the doctor's offices they want, but that's all that's going to do is take away from the supply that we're currently getting and or the hospital system. So interesting enough, people sometimes are trying to figure out, how to date, how many doses have we gotten as a county, Macomb, Oakland, and Wayne? And there is no rhyme or reason. We don't know the reason why. We ask for what we're going to be asking for, again, 50,000, and we get to 5,000. So we tried to look around, and we were able to find out, and you get it through the state website. In fact, I'm just going to show you this. This is what health departments are getting in the Tri-County area. And when I say health departments, I'm talking about in Wayne County, including the city of Detroit. So the health departments in Wayne and the city of Detroit have gotten 37,000 doses. And when I'm using doses, understand this, that we're accounting for, this is the total, but you got to kind of cut that number in half because each person is going to have 2 doses. So 37,000 is the number of doses they've gotten to date. Oakland County, 23,000 to date. And then obviously Macomb, 22,000 to date. But here's the interesting thing, because we've been asking about this, is how is it getting to some of the public through other means or other outlets, and specifically the hospital systems? Well, if you incorporate the hospital systems, adding the number here as far as the doses we're getting from the actual health departments, if you add it, take a look at Wayne County. So far to date, 133,000 doses is what they've been able to get. And yet, the health department's only getting 37,000. So the question is, where's that other 100,000? It's going to other providers. I'm going to get to the concern about that in just a second. Look at Oakland County. To date, 146,000 doses they've got, yet their health department has only gotten 23,000. So the total allotment in Oakland County, 146,000, yet they're only getting 23,000 at the health department. Here in Macomb, 22,000 to our health department, but yet 67,000 have been allotted throughout the entire county. So the question is this, and this becomes the big challenge. The only game in town where people can go ahead and get an appointment, actually call a phone line or go online, are health departments. So they're actually looking to go after these limited numbers that we're getting, yet somebody else has got doses available, and the question is, how are they getting it out to the public? And it's not based upon appointment by you calling, they're reaching out. So my offer to you is this: you need to get a hold of your healthcare providers, maybe even the hospitals, and see if you can't get an appointment somehow through them, because they're getting a substantial amount of these doses. We're not trying to pit health department versus our hospital systems here, but again, I think there's been an admission on behalf of the state that they opened it up way too fast. The best thing to do, put politics aside, Democrats, Republicans, and all these other animosities and tensions, put it aside. The best thing to do right now is to show leadership and say, you know what, we probably opened up too early for all these other groups. What do I mean by that? Well, it should have been specific to our senior citizens. Our senior department has sent us a letter saying we need to refocus. We need to do what the CDC guidelines said and support those that are 75 years of age and older or 65 with an underlying health issue. That's the way this was supposed to go, specifically if we have a limited number of doses. And we all know that. So we need to figure out how do we go back to that. That's a challenge, but it's going to take true leadership for someone to say, you know what, we probably geared up a little bit too early knowing we don't have those doses, so we need to take a step back. And that's what should be happening. By not doing that, it continues to create this frenzy and this panic, if you will, or the crisis within the crisis. And then as we start getting through those people, the groups that we're talking about here with our seniors, if we realize we're getting through them and we're getting more doses, then open it up to those other categories. And again, whether you want to call them essential versus non-essential, I don't know how they want to categorize it. How do you call somebody essential versus somebody being non-essential? That's still interesting uniqueness in the definition, because opening it up right now for firefighters, for teachers, police officers, you know, that's all great, that's all well and good. But if they all have to compete with one another as well as our seniors, again, the number of doses that's going out is a tremendous challenge, and I got to believe everybody would agree that they probably know somebody, they have a parent or somebody in their neighborhood that is a senior that probably should be getting this, because the data and the science say they're the ones most vulnerable. We need to take care of them and protect them. But that's just not happening right now, and I guess the big challenge we're having is people are going to continue to be frustrated with the system that we have in place right now statewide. Competition
to access the limited doses has probably been the most frustrating thing when we look at our system, Mark. It's in place. Everyone that has had the opportunity to go to our site over at the VCULin building has celebrated the efforts of the health department, the immunization specialists, and everyone that's been a part of that entire ability for us to get the vaccinations to those individuals that have been able to get those limited doses again. But we're limited. The potential has been limited. That is something that you've talked about too over the past couple weeks here, is don't limit our potential. Get those additional vaccine into those providers' hands so that we can ensure that those doses get out to the public as critically as they're possibly needed right now. It needs to be #1 priority on all fronts, and most importantly, that's how we're going to continue to engage the state and advocate for those folks, especially the senior citizen in Macomb County, that since the outset of here has been the unifying element that has been viewed as the most vulnerable population.
Yeah, so we're going to continue to push forward on their behalf to try to figure out how do we reel this back and get the state to recognize that, or obviously try to get more vaccine. It's got to be one or the other. Either we shorten the demand side of this or we enhance the supply side, but it doesn't look like that's going to happen as far as the enhancing of the supply side. So, with that, we have reached out, as I mentioned, to the federal government, to obviously the president, and said, hey, give us 50,000, we'll manage it. In fact, health departments understand how to manage these things. They've been doing this for decades. This is not something new to them. And so with that being said, their frustration is, how come some of these pharmacies aren't open up? How come the doctor's offices aren't open up? But they also realize even if they are opening, they're competing with the limited number of doses we're getting. So to do that, we have to obviously enhance the number of doses we're getting. But if we know that they're not there, then why are we continuing to open it up to all different walks of life? In fact, I'm hearing from the folks that are working in the grocery stores, how come we weren't considered to be part of that. The clergy just sent me something today saying, why aren't we being considered, as part of this? And again, I don't have an answer for them. I don't have an answer. The reason they're not is because it wasn't one of the groups or categories coming from the state to open it up for them to be vaccinated. But let's face it, all of those folks, all of those other essential folks should be set aside right now to focus on what the CDC says is the most important and the most vulnerable, and that's our seniors. Let's take care of them first with the limited doses we have, and then we can start to figure out how do we decide who's next when we have available allotments of doses, and we've opened up access points like we always have done for obviously people to go ahead and set appointments with pharmacies, with doctors' offices. That's how this should have been done, and it's not being done that way, and it's creating an incredible amount of tension, and we hear it every day, especially after the Tuesday when our phone lines are opened up and people can't get those doses. Boy, I'll tell you, the next 2 or 3 days, we get some very interesting comments and emails from people, and I guess to be expected to some extent.
Yeah, Mark, I think the other thing to keep in mind too is the immunization game is something that we do here with regards to our public health response. Andrew Cox and the team have not only been able to roll out the flu shot year after year after year, tuberculosis, measles, mumps, anything that kind of arises on that one, even historically when there was the swine flu, H1N1, all that stuff. We do this, but now systematically when those priority groups have already been received and we're chasing again that demand with limited supply, it's a difficult challenge on so many fronts. But again, it's one of those things where as we continue to keep on message, specifically what we're looking at with our operations, and advocate to get additional doses into our community, we know that we have the capacity. Now it's just getting those doses.
Right, and so nobody can deny that there's a limit of supply. Everybody has agreed that's a problem right now. So we will continue to do with what we get. There's absolutely no problem there. Our health department can do more, and as we mentioned, we're being limited. Our potential is being limited because of the lack of supply. We want to vaccinate more. We will vaccinate more. We can vaccinate more. We just need more to do that. And so, with that being said, credit to the health department. They're on board. Not something new for them to deal with. But again, we continue to try to get people to understand the facts, the real issues that's going on here. I think it's starting to get through. I think people are starting to realize, even hearing everybody else say, yeah, I guess we kind of made a mistake there, opening up the demand without having a supply. So we're fortunate there, but we got to continue to ask people for their tolerance and their patience in this matter, specifically with health departments around the state, not just here in Macomb County. They can do more. They will do more. They just need more to make that happen.
Absolutely.
So, we're going to continue to ask for that. We hope, and we've been seeing, a lot of the people that, believe it or not, are being scheduled right now, and I think it's a lot of friends and family members and people calling in on behalf of seniors. So we had a good response for the people that took up some of these, if you will, appointments that are seniors. And I was so glad to see that. And I think it's because people are realizing, you know what, there is a sense of self-preservation I have. I know I'm one of the people in that category, but I think I'm going to call on behalf of my mother, my in-laws, a family, a relative, because they're elderly, and I'm trying to figure out how do we get them taken care of first. So I was really taken
It's a
back by
refreshing
that.
trend to see.
It was, and a lot of our phone takers were saying that today as we talked to them. So they were gratified by that as well. And understandably, yet it's still open to these other categories. But we're seeing people are willing to take care of our seniors here in Macomb County, and with that, I couldn't be more pleased to hear that kind of a sentiment. So, again, on behalf of us all here in Macomb County, we want to thank you for your tolerance, your patience, understanding of these issues. We're going to continue to push forward for more vaccinations because we know we can do more. But in the meantime, we want to again try to convince you to keep you and your family safe.